Hello, everyone, and welcome to another episode of Health Matters. I'm your host, Adam, and today we're diving into a topic that affects millions of people worldwide, diabetes and its complications. We're going to discuss common complications associated with diabetes and, most importantly, how to avoid them. Today, I'm thrilled to introduce our guest, Jessica Thompson. Jessica is a certified diabetes educator and has over a decade of experience working with patients managing diabetes. She's also a passionate advocate for diabetes awareness and education. Welcome to the show, Jessica.
Thank you so much for having me, Adam. I'm excited to be here and share some insights on diabetes and its complications.
Let's jump right in. Could you start by outlining some of the most common complications that people with diabetes might face?
Absolutely, Adam. Diabetes can lead to several complications, and it's crucial for patients to be aware of them. The most common include cardiovascular disease, nerve damage or neuropathy, kidney damage or nephropathy, eye damage or retinopathy, and foot complications. Each of these can significantly affect a person's quality of life, and many of them are preventable with proper management.
That sounds concerning. Can you elaborate a bit more on how these complications develop? For instance, what causes cardiovascular disease in diabetic patients?
Great question. In diabetes, high blood sugar levels can damage blood vessels and nerves that control the heart. This can lead to an increased risk of heart disease and stroke. Additionally, diabetes is often associated with other risk factors like obesity, high blood pressure, and high cholesterol, which can compound the issue. The key is to manage blood sugar levels effectively, along with these other risk factors.
It's interesting to hear how interconnected those issues are. Now, let's talk about neuropathy. How can someone recognize the signs of nerve damage?
Neuropathy can manifest in various ways, but common signs include tingling, numbness, or pain, particularly in the feet and hands. Some patients might also experience a loss of sensation, which can lead to injuries going unnoticed. It's essential for individuals with diabetes to have regular checkups where they can discuss these symptoms with their healthcare provider.
That's an important point. Early detection must play a huge role in managing these complications. What proactive steps can someone take to prevent these issues from arising?
Absolutely, Adam. Prevention starts with education and awareness. First and foremost, managing blood sugar levels through a balanced diet, regular physical activity, and medication adherence is crucial. Regular checkups are vital as well. Monitoring blood pressure, cholesterol levels, and routine foot exams can catch potential issues before they develop into serious complications. Additionally, patients should avoid smoking and limit alcohol consumption, as these behaviors can exacerbate complications.
It sounds like a lot of it comes down to lifestyle choices and regular monitoring. Are there any specific dietary recommendations you would suggest for someone looking to reduce their risk?
Definitely. A diet rich in whole grains, lean proteins, healthy fats, and plenty of fruits and vegetables is beneficial. Foods that are high in fiber can help regulate blood sugar levels, and it's important to limit processed sugars and saturated fats. Additionally, portion control is vital, as it helps maintain a healthy weight. Working with a dietitian can also provide personalized meal plans that suit individual lifestyles.
Those are practical tips. Now, many people might feel overwhelmed by the idea of managing their diabetes. What advice would you give to someone who is just starting this journey?
It can indeed feel overwhelming at first, but breaking it down into smaller, manageable steps can make a big difference. I always encourage my patients to set realistic goals, whether that's walking for 10 minutes a day or trying a new recipe each week. Connecting with support groups can also provide encouragement and share experiences. Remember, it's about progress, not perfection.
That's a great perspective, Jessica. It's all about finding what works for you and making sustainable changes. Before we wrap up, do you have any final thoughts or additional resources you'd recommend for our listeners?
Certainly. I encourage everyone to check out the American Diabetes Association's website for a wealth of resources, from meal planning tools to community support. Additionally, engaging with healthcare professionals regularly can provide personalized support and keep you informed about the latest in diabetes management.
Thank you so much for those insights, Jessica. I really appreciate you taking the time to share your knowledge on such an important topic.
Thank you for having me, Adam. It's been a pleasure.
And thank you to our listeners for tuning in to Health Matters. Remember to prioritize your health and stay informed. Until next time.